Welcome to another practice question video. The best way to pass nursing exams is to practice questions every day. Now let's begin. Starting with question 1. When obtaining the initial health history from a 10-year-old child with abdominal pain and suspected appendicitis, which of the following questions would be most helpful in eliciting data to help support the diagnosis? Where did the pain start? What did you do for the pain? How often do you have a bowel movement? Is the pain continuous or does it let up? The answer is: where did the pain start? The most helpful question would be to determine the locaito of the pain when it started. The pain associated with appendicitis usually begins in the periumbilical area. The physician has ordered several laboratory tests to help diagnose an infant's bleeding disorder. Which of the following tests, if abnormal, would the nurse interpret as most likely to indicate hemophilia? Bleeding time. Tourniquet test. Clot retraction test. Partial thromboplastin. The answer is partial thromboplastin. PTT measures the activity of thromboplastin, which is a dependent in intraosseous clotting factors. A 21-year-old male client is transported by ambulance to the emergency room after a serious automotive accident. He complains of severe pain in his right chest where he struck the steering wheel. What is the primary client goal at this time? Reduce the client's anxiety. Maintain adequate oxygenation. Decrease chest pain. Maintain adequate circulating volume. The answer is maintain adequate oxygenation. Blunt chest trauma may lead to respiratory failure, and maintenance of adequate oxygenation is the priority for the client. The nurse is reviewing the chart of a 55-year-old male client who is scheduled for a lumbar laminectomy. The nurse should notify the surgeon of which nursing assessment finding? Pimple on lower back. Abnormal electrocardiogram, ECG. Heading aid. Allergy to iodine. The answer is pimple on lower back. A pimple close to the incision site may be reason for the surgeon to cancel the surgical procedure because it increases the risk of infection. A 15-year-old girl is brought to the high school health office by two of her friends, who state, "We think she just took a handful of pills." The adolescent appears alert and refuses to speak. The school nurse's entitled response should be to ask the friend where she got the pills. Ask the adolescent if she took any pills. Call the rescue squad to stand by for an emergency. Call the adolescent parents to tell them they must come immediately. The answer is ask the adolescent. This is the most direct approach to ascertain if pills were ingested. The client usually will respond to this type of direct question. A client is having a vacuum curettage abortion because of a fetal demise at 16 weeks gestation. The partition prescribes a dinoprostone, Cervidil, suppository to allow softening, effacement and dilation of the cervix, ripening. What should the nurse teach the client about the procedure? General anesthesia will be used to insert the suppository. There will be copious bleeding for several hours after the abortion. Temperature of more than 100 degrees Fahrenheit is common for the first 24 to 48 hours. After the insertion of the suppository, you should lie flat in bed for 15 minutes. The answer is after the insertion of the suppository, you should lie flat in bed for 15 minutes. Remaining supine for 10 to 15 minutes permits the suppository to remain in place while it settles to body temperature. A woman is admitted to the emergency department with trauma that indicated possible abuse. List the priorities in orders of the appropriate nursing interventions. Gather more in-depth history. Provide information about safe houses. Encourage the client to ventilate feelings. Assist with treatment of physical injuries. The answer of order are D, A, C, then B. Treatment of physical injuries is always the priority of care. Further information about the client's history is needed to determine if she is in an abusive situation. A client weighs 21 pounds on admission to the hospital. After 2 days of diuretic therapy, the sealant weighs 205.5 pounds. The nurse estimates that the amount of fluid the client has lost is 2.0 liters, 0.5 liters, 1.0 liters. 3.5 liters. The answer is 2.0 liters. 1 liter of fluid weight approximately 2.2 pounds, therefore a 4.5 pound weight loss equals approximately 2 L. A 6-year-old child with glomerulonephritis has a fluid restriction of 600 milliliters in 24 hours. How can the nurse help the child cope with this limitation? Withhold fluids from 7 p.m. to 7 a.m. Divide fluids equally among each shift. Allows fluids as desired until limit is reached. Offer fluids in medicine cups throughout waking hours. The answer is offer fluids in medicine cups throughout waking hours. Offering fluids in a full 1-ounce medicine cup allows the child to drink without a long time between drinks. A full container creates an illusion that they are having a lot of fluids. A client with rheumatoid arthritis calls the outpatient clinic to report that the pain lasts for 2 to 3 hours after exercise. What is the nurse's most appropriate initial response? Stop exercising for the day? Increase the number of repetitions of each exercise. Decrease the number of repetitions of your exercises. Limit progressive resistant exercises to 3 times a day. The answer is decrease the number of repetitions of your exercises. Exercise should be to tolerance only, limiting the amount of exercise should decrease pain. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.